If you just found out that you're pregnant, hang on to those sticks because let's talk about what to do next. Let's talk about caffeine. Cue the pour. Ever since you saw the 2 lines on the test, the wheels have been turning. So you can add whatever questions you like to this. You might have heard that you're not supposed to tell somebody that you're pregnant till X number of weeks, but screw that. It's like tranquilizer dart real, the exhaustion. Cutting out alcohol is really important. Sticking little things in your mouth to survive instead of to thrive, like I did. Right off the top, the very first thing you're gonna do is take a big breath in and out. I'll do it with you because maybe you've been waiting what feels like your whole life to see those 2 lines, but maybe, just maybe, this pregnancy is unexpected or unplanned. But either way, your life is about to change in one way or another. So take it all in, take a minute, and now let's get to the list. Next up, if it feels good, tell someone. You might have heard that you're not supposed to tell somebody that you're pregnant till X number of weeks, but screw that. If it feels good to you, tell whomever you like. Maybe you're in a supportive, loving relationship with your partner, you've been planning this pregnancy and you cannot wait to tell them. But that's not always the case, right? I mean, it might be that you don't even know your partner or you have a bad relationship with your partner. There are a ton of things possible here. Personally, I told people really early because that was my close circle of friends, and if I did happen to have a miscarriage, I would want to confide in them and talk to them about that miscarriage, so it was important to me that they knew. So feel that out and tell who you please. I am going to pause here briefly and I'm going to talk about miscarriage. So this is your trigger warning that I'm talking about pregnancy loss. Sadly, for around 1 in 4 women, miscarriage is a real possibility. Now, most miscarriages are going to happen in earlier pregnancy, in that first trimester, sort of the first 12 weeks of pregnancy. But I want to remind you that miscarriage is still the exception to the rule. It's not the rule itself. But for a lot of people, you may have already experienced loss in your journey to becoming a parent, and it can cause quite a bit of stress and anxiety. So there are lots of reasons for miscarriages. A lot of them are unknown, but around 70% of them, they're caused by a chromosomal abnormality. If you do want more information about miscarriages, I'm going to put some links in the description. I know this feels early, but the next thing you gotta do is you have to pick a provider to take care of you and to take care of your baby. And you also have to schedule that first prenatal appointment. Like, you're gonna have a baby, so let's start to get organized. You have a few options to choose from depending on where you live. There are obstetrician gynecologists, there are also midwives, and then there are family doctors who have experience with obstetrical care and maternal care. And they are all very different, and I have worked with all 3 of these types of providers. My name is Tina. I'm a labor and delivery nurse with my certification in perinatal nursing. I am also a certified breastfeeding specialist, and if it is your first time here, welcome, welcome. If it's not your first rodeo, welcome back. We are now going to get into the differences between all of these types of providers and what they can offer you in your prenatal care. Let's first talk about midwives. A midwife is going to be a great choice if you have a low risk, uncomplicated pregnancy. They are also phenomenal because they give you this kind of comprehensive care. They're going to care for you during your pregnancy. They're going to be there more hands-on during the entirety of your childbirth, or at least as things really get heated up. And then they're also going to take great care of you in the postpartum period. What I love about midwives is that they usually have a really comprehensive education on things like lactation and breastfeeding, which I of course think are really important. Now, a midwife is a great choice if you are going to be doing a home birth or a birth center birth, because your other providers will not be doing those types of births. But midwives also usually have privileges at hospitals, so you can do a hospital birth with a midwife as well. They're usually pretty low intervention. A lot of people that want an unmedicated birth might prefer to go with a midwife over an obstetrician gynecologist. Something to note though, midwives do not have surgical privileges. So if you need to transfer in from home or transfer into hospital from a birth center, your midwife would likely transfer care over to an obstetrician gynecologist. And if you need a C-section, they cannot perform that C-section. So again, they would transfer your care to an obstetrician gynecologist. Now, that is not to say that if you do end up in the C-section, that your midwife can't go in there with you. That's just going to depend on the site. But midwives are a really great option for these low-risk pregnancies. On the other hand, if you're going with a physician, you have those two options. You have an obstetrician gynecologist, or you have a family doctor with experience in obstetrics. An OBGYN, they are a specialized medical doctor with a ton of experience and knowledge in the areas of pregnancy and labor and childbirth, and they are also trained surgeons, and they are trained to take care of high-risk pregnancies. If you're wanting a birth outside of a hospital, so birth center or home birth, this is not the road that you're going to want to take because they don't practice outside of those scopes, outside of a hospital or outside of a clinic. But if you do need a C-section, this is going to be the doctor that you want to go see because they are specialized, trained surgeons. Also, if your obstetrician is a maternal fetal medicine specialist, this type of obstetrician, they care for the highest risk pregnancies and the most complicated pregnancies. And a family practice physician or a general practitioner, they're almost a nice blend of both, and they can care for the whole family. So once you give birth, then you and your baby would have the same doctor, and twinning is super cute. We love that. But also, they sort of view birth as like a natural life process, and it's a little bit more family-centered. There tend to be a little bit lower intervention as well. However, not all GPs or general practitioners will have surgical privileges. So if you're giving birth under the care of a GP and things start to go a little bit sideways, they will likely hand off your care to an obstetrician gynecologist because they are the experts in complicated pregnancy conditions. So there is a chance that they'll go into the operating room with you and be with you, maybe even assist the OBGYN, but they won't be the one performing a surgery if you need it. Something else you might want to consider doing is making a list of questions to ask at your first prenatal appointment, which you have already made because we talked about how important it was to find the provider and make the appointment, right? But my list of questions that I would ask as a first-time patient with this provider in my pregnancy might be totally different than the questions that you'll want to ask because ever since you saw the 2 lines on the test, the wheels have been turning. So you can add whatever questions you like to this. I would start with, if I am already exercising, can I continue or should I modify? And is it safe for me to add in exercise if I'm not already exercising? You can ask, are there any foods that I should be avoiding in this pregnancy? Because you might have heard that there are some foods that are not safe in pregnancy, but that may not be the case. You can also ask all of the can I questions. Can I dye my hair? Can I go tanning? Can I get Botox? Can I travel? Those are great to clear up earlier so that you don't wonder as you move along. You can ask things like, are there extra vaccinations that I should be getting? If I get sick with a cold or flu, what medications are safe to take in pregnancy? Are the medications that I'm already taking for other conditions still safe to take in pregnancy, or do we need to modify them? You may want to ask them, what are your rates of C-section? What are your rates of episiotomies? And what are your rates of using things like forceps and vacuums? Because the answers that you get to those questions may make you feel really good about the choice you've made about your provider, and they may make you rethink who you've chosen for your provider. So those are really good things to ask. You may also want to ask, are there things in this pregnancy that make me high risk? Are there things in this pregnancy that make you think I might need a C-section down the line? And how long can I continue to work for? And a big tip that I have is to keep a running notebook of these questions. And then whenever they pop up through the day, you can just add them to the list. Because if you've never been to a prenatal appointment before, sometimes they can be a little bit rushed. And in those rushed moments, you might forget some of the questions that were burning on your mind before you went into that appointment. But if you have your list in front of you, you can just rapid fire them and get all of the answers that you need from your provider at the time of your appointment. And keep it by your bedside table because a lot of times you'll be just drifting off to sleep and you'll think, that's another question that I wanted to ask. That brings me to the next thing on your to-do list, and that is to come up with a work plan. Now, you don't necessarily have to tell your employer right away if you don't want to. However, you might anticipate needing time off, especially in earlier pregnancy. This can be for things like morning sickness or exhaustion. It's like tranquilizer dart real, the exhaustion. But you might also anticipate needing time off for prenatal appointments because oftentimes prenatal appointments, they are not offered on evenings and weekends, and those are really important to keep up with. Now, all of the maternity leave and benefits, they vary province to province and state to state. They even vary country to country. Here in Canada, we do get 1 full year of paid maternity leave from the government, and then some jobs will offer a top-up so that some people are actually making their full wage for that full year, but that varies person to person. And in the United States, we know that there is no mandated amount of paid time off for maternity or for parental leave. So it's time to start looking into what your specific employer is going to offer you, and you might also want to look into FMLA. Here in Canada, you are protected against discrimination based on the Canadian Human Rights Act, and in the United States, it is also illegal to discriminate based on pregnancy, and you're protected under the Pregnancy Workers Fairness Act. And I think both of these are really great to read up tap on. So I'll pop the links to both of them in the description. And one more thing, if you're thinking about going back to work sooner than later, you are probably already going to want to put yourself on some wait lists for childcare. I know it seems early and the baby is just in there, but trust me, some of the lists can be really long. It's now time to cut out any substances that can cause harm to your baby. Now, ACOG and the CDC, they both recommend against the intake of cannabis, illicit drugs, or the misuse of prescription medications while you're pregnant. And this is because these substances, they can pass directly through the placenta to your baby. And this can cause birth defects, preterm birth, or stillbirth. And in some situations, it can actually cause something called neonatal abstinence syndrome, which actually causes your baby to go through withdrawals after they are born. Tobacco is also something that you're going to want to consider giving up now that you are pregnant. Now, the best time to quit smoking is, of course, before you get pregnant, but that's not always possible because, life. But if you're able to quit smoking now, or even reduce the number of cigarettes that you smoke in a day, that can be really beneficial to your developing baby. Because when you smoke cigarettes, the stuff that's in the tobacco leaves that you're inhaling can pass through the placenta, and it has the possibility to cause those things like birth defects and preterm birth and stillbirth and even low birth weight in your babies. And not only that, the carbon monoxide and the nicotine that's going through your bloodstream causes oxygenation issues for baby. And if people are smoking around you, even though you're a non-smoker, it is time to tell them to take it outside. And finally, you knew it was coming, right? Alcohol. Now that you're pregnant, cutting out alcohol is really important. Both the CDC and ACOG agree that there is no safe amount of alcohol consumption, and there is no safe timing of alcohol consumption in pregnancy. There's just not enough data to say, yeah, you can have a glass a week, that's safe, or yeah, you can have it in the third trimester. So avoiding alcohol is important because that alcohol crosses through the placenta and it has the ability to cause birth defects and preterm birth and stillbirth and SIDS, but also a wide variety of intellectual and behavioral and physical disabilities known as fetal alcohol spectrum disorder. It's also important to note that countries varying around the world have different sort of ideologies on what is safe for alcohol consumption in pregnancy. So depending on where you live, you might get different answers from your provider. But knowing that alcohol can be harmful in a pregnancy is important, and knowing the risks are important. So if alcohol consumption during pregnancy is important to you, please ensure to talk to your provider before you have another beverage. And caffeine, let's talk about caffeine. Cue the pour. Ah, that felt good. You will be happy to know that no, you do not have to cut out all of the caffeine in your life. You can continue to go on those Starbucks runs even though you are growing a baby inside. However, ACOG reports that you should keep your caffeine intake under about 200 milligrams a day, which is about 2 cups of coffee. But remember, this is a total caffeine intake, and there are lots of things out there that you might eat that do contain caffeine, and you might not be adding that to your list. So make sure that you're thinking about your total caffeine intake during the day, and this is probably because higher levels of caffeine have been linked to miscarriage. And finally, the last thing on your list, now that you're pregnant, is to take a prenatal vitamin every single day. And it's important for a few reasons. First off, that first trimester is freaking brutal. You might be sick to your stomach or throwing up, or you might just have like zero appetite and you walk around all day just sticking little things in your mouth to survive instead of to thrive like I did. So prenatal vitamin is going to give you some of those vitamins and minerals that you are missing out on from not having that nice balanced diet. Another reason is you can see the vitamins and minerals that should be in your body for your baby to really thrive. So a prenatal vitamin can help top up some of those levels for baby. And then finally, folic acid is really, really important, and you're going to find it in most prenatal vitamins. ACOG recommends a minimum intake of 400 micrograms of folic acid every single day before you get pregnant, and then at least for those first 12 weeks of your pregnancy. And folic acid does a lot of things for our babies, but very importantly, it helps protect them against neural tube defects, which are malformations of the brain or the spinal cord, and those can be absolutely devastating for a pregnancy. But there are lots of people that talk about prenatal vitamins, what you do need and what you don't need. So if you're looking for a great video that goes over the things that should be in your prenatal vitamin and goes through all the vitamins that you might find at Target, you can check out this one right here. And I loved having you here. Give this one a thumbs up if you loved it. Consider subscribing, and I'll see you in the next one.